Let's go back to Ottawa, where MPs are commenting after question period. Here is the Minister of Health talking about the coronavirus outbreak, Patty Hajdu.
The United States, and along with our G7 partners, and I've been having weekly meetings with ministers of health, so that's been very helpful to understand where people are at in terms of their preparedness. I will remind Canadians that the American system is very different than ours, and we do have a pandemic plan, and we have been working provincially and territorially with our partners across the country since Dr. Tam noticed, in fact, in late December, the cluster of infection that was happening in Wuhan. And so we have an advantage of having that pandemic planning well in advance. We also don't need to call it a public health emergency in order to trigger all of those systems and structures to come into place. And we also have a robust system of testing, as you know, both at provincial level, but also the federal lab that's able to provide testing results very quickly and confirm testing at the provincial level. So we're in a different situation than the United States from an organizational perspective. But what I would say is that I reiterate their concern around the potential of an outbreak in Canada. You know, we obviously have been monitoring the situation closely, and as the virus has spread internationally and countries are now finding themselves in circumstances that just a week ago they weren't, what it indicates to us is that the spread is happening and that we must be prepared in Canada.
What can be done for the people in Iran, Canadians who are eager to leave?
Certainly, I think through Minister Champagne's office, they're obviously offering consular support, but I think we should be clear that repatriation efforts are limited at this point. It's difficult at this point to commit to an ongoing repatriation process. We have to remember that takes a lot of resources, and the resources have to be focused in terms of our domestic response. It's important for Canadians to realize that this may cause disruptions in their lives. It might mean that if someone is ill in their family, that people are isolated, that businesses may have to have contingency plans if in fact there is a outbreak in their particular community. And I think that's the focus that we have now, is really ensuring that provinces and territories have what they need from a health systems perspective, and that Canadians are taking steps to protect themselves and to prevent disruption in their lives should there be an outbreak in their community.
When the spread was contained in Wuhan, there were screening measures at the airports for people coming back from the region. So perhaps they were asked if they were coming back from Wuhan, if they had symptoms. Are you going to implement the same sort of pre-screening from people coming back from Italy or from Iran?
Because there's 35 countries in play now that we know of, and I would suggest likely other countries that we don't know of, screening becomes less relevant, and domestic delay and mitigation is more important. Let's not forget that it's also flu season, so if we can delay the onset of any outbreak in Canada to get us through flu season, it will actually alleviate the burden on our healthcare system, but it will also then provide us a bit more of a window to understand the virus and give some time in terms of possible antidotes for people that are ill with the virus.
But there are countries, if I could just get a follow-up, there are countries where it seems to be a bit worse than others, maybe less contained, like Iran at the very least. Is there no measure that you can take to have a better look at people coming back from there, given that we've now seen cases of spreads in Iran?
So that level of screening at the airport has proven in previous outbreaks not to be efficient. So for example, in SARS, everybody's temperature was taken. Not one case of SARS was detected during that
or without
time.
Doing that,
but we have
suggesting if you have symptoms, maybe
so we are doing
isolated.
that. So there is new information for international travelers from any place to monitor themselves. In fact, if they feel ill or unwell, to contact local public health to let them know that they've traveled internationally. And obviously, travel advice is changing for people passengers that are choosing to travel to other countries. There is travel advice based on the severity of outbreak in those particular countries.
So it's not country specific; it's just that wide, is what you're saying.
For international travel, for Canadians traveling outbound, yes, there is specific information and risk levels associated with countries' experience around coronavirus. Mm-hmm. But for people coming from international travel and returning to Canada or coming to Canada, the messages around screening for any concern around health.
Can we come back to, obviously, there's been a lot of this stuff has been limited to the people who travel internationally. But what is your message, and just recap if we could, for the average Canadian, be it on the streets of Port Arthur or in Etobicoke or Lethbridge, there is an element of the population that will get a little freaky about this sort of stuff. So
absolutely.
What's your message?
Well, first of all, I'm the kind of person that likes to prepare for the worst, and if we can say later on that we've had too much preparation, then I think I'd rather err on the side of too much preparation. And so I think for Canadians, the message is, first of all, protect your health, wash your hands frequently. If you're sick, stay home. If you're able to, determine that you're not feeling well, to stay home and prevent the risk of spreading illness in the community. I would remind Canadians that it is flu season and to get your flu shot. It will help eliminate the flu if in fact you find yourself ill or severely ill. It will also help reduce the burden on healthcare, which we will want to be doing so that we can respond if there is an outbreak. And finally, I would say to Canadians that preparing yourself and your lives to be ready for disruption is always a good measure. Obviously, emergency preparedness is always a good measure. We don't know whether the power will go out or whether there will be an outbreak in our community, so having a supply of food on hand or, your prescription medications filled up, those are always good measures to have. And I think when we live in a society that's just in time like ours, we often forget that disruption can happen whether it's a snowstorm or an outbreak. And so my message to Canadians today is to take it seriously. Obviously, we are working very closely. There's still, at this point is not, there are not many cases in Canada, but that could change at any time given that there is such a transmission globally.
So can you talk a little bit about, I guess, sort of the communications channels that are ongoing because the coronavirus has now become really a global health emergency that we saw a few weeks ago, but now, as we were saying, countries like Italy, Iran, and others. What is happening, I guess, behind the scenes to stay, abreast of the developments and keep Canadians safe?
Yeah, so at many levels, officials are working together to, from a public health perspective, to make sure that local public health systems are strong, that our hospital and our healthcare systems are strong and have what they need. The federal government has a convening power, and we've used that, and so there are multiple groups meeting to talk about various aspects of infectious disease process, making sure that the equipment is in place, that the right protective gear is available at the various provincial levels, as well as we have a scenario planning at the whole of government approach to sort of understand what this disruption might look like in a larger scale for our country.
Last question.
Oh, you're all good? Okay, thank you very much.
I like your shoes.
And that is Patty Hajdu, the Minister of Health, talking about the coronavirus outbreak, saying that there is a pandemic plan in Canada, that there is robust testing at the provincial level as well as at the national lab in Winnipeg, that there is potential for an outbreak because of the spread globally, but the risk in Canada is still low. She said the spread is happening, though, and that we must be prepared in Canada. She said, in terms of her message to Canadians who may be worried, she says she is somebody who likes to prepare for the worst, so people need to wash their hands. If you're sick, to stay home, take it seriously. And again, there are not many cases in Canada, but given that it is spreading around the world, that could change at any time.